Welcome, my name is Ajwa Chimerting from the National Minority Quality Forum, and welcome to For Your Health News. Your health, your news, your power. And I'm here with Dr. Donney John. Introduce yourself.
Sure. Hi, everyone. My name is Dr. Donney John. I'm the Executive Director of NOVA ScriptsCentral, a nonprofit pharmacy based in Falls Church, Virginia, and I'm from Northern Virginia.
And we're so glad to have you here because you are just a long-standing, professional when it comes to the health equity space. You long in the tooth in that regard, as far as being a pharmacist, but also being a health equity advocate. Can you share a little bit about your journey as to how you decided to sort of go beyond your quote unquote 9 to 5 to get more involved in health equity issues?
Sure. I think it's growing up as an immigrant in this country, understanding the struggles that not only my family, but my community. I grew up in New York in a very diverse background with a lot of people from different ethnic groups really trying to figure out how to access healthcare, just services in general. So I think growing up, seeing my parents navigating the system, their challenges, it's really inspired me to figure out how do I fix these issues so that other families don't have to go through the same learning experiences, good and bad, that I've had to incur.
And so in your profession, what was the first thing you wanted to fix?
Health literacy. A lot of times we talk about health, but we don't talk about it in the terms of making people understand. Mm-hmm. And also the cultural competency perspective of not everybody speaks English and not everybody has information in their native language. So for me, my passion over my 20 plus years has been health literacy and cultural competency, is how do we empower communities from all backgrounds to really understand health information so that they can be empowered to make a choice.
And have you seen progress at all? I mean, we've been fighting for health equity at NMQF over 2 decades. And a lot of people say we're just not really seeing any progress. But have you seen progress in health literacy at least?
Yeah, I think we have made a lot of progress, especially being more inclusive in terms of people with disabilities and having more information that's translatable. There are a lot of great organizations. NMQF has definitely taken the lead in bringing people together for stakeholder conversations around cancer and other really big health topics, and really lending a voice to all communities, regardless of race, gender, or background. NMQF has done a really good job of bringing us together to have a unified message.
So let's talk about hot topics. In your view, in your perspective, what are the hottest topics in health equity today?
I still think health literacy is a big issue where we're not breaking down information simple enough to connect people. We have built a lot of great resources, but the messaging is not clear enough where communities feel comfortable, because most people are not going to read scientific journals. They're not going to go to their doctor's office believing what they're hearing. They're really looking at their friend. So we really do need to work on building trust and making sure that communities are getting information the way that they want to hear it, whether it's through social media, whether it's through word of mouth in their community, whether it's through their church, their synagogue. We have to be where people are and really communicate on a personal level. And empathy is the best way to really help us create a strategy around that.
So you kind of jumped to it. You talked about social media, you talked about through church and through our social spaces, but a lot of times folks don't have the information. So how do we close that gap? How do we equip people with the information who are already the trusted voices in order to reach folks?
So I think first we have to build with them. A lot of times we build in a vacuum instead of building with the people that community members are trusting in the room. So finding the trusted messages is not challenging if we look at the right places. A lot of times people use that as a cop-out, as an excuse not to do the work, where English is the primary language. We'll put that on our product roadmap, or we'll figure out how to translate materials later on, instead of designing it from the beginning, where there's lack of resources and a lack of funding. So we have to look at how do we judiciously spend the money to make sure resources are being scalable and actually used by the community that we're trying to target.
Okay, so you talked about resources and spending money, but as you know, federal funding is being cut for a lot of health promotion programs across the country. So where do we find the resources now? How do we fill in that gap?
So I think there's a lot of resources out in the public domain. It's just a matter of knowing how to elevate those resources, because everybody's creating things in different silos. And when we look at the United States, we're a cultural melting pot. It used to be that we would have big metropolitan areas where we'd see predominantly specific ethnic groups. But when we look at Minnesota, It is a very culturally diverse community with a lot of richness in terms of all demographics. And they have a lot of great health education in multiple languages available through their state. Same thing in California and Texas. So we need to look at how do we collate these resources, make it easier to find. And hopefully with AI, it allows us to figure out how do we make it an easy catalog of educational content. My organization, we develop a lot of educational content on our own, really reflecting the diversity of the community. Plus it helps to have a diverse workforce, a diverse staff that can create this content.
So, some people have complained or shown some concern about AI, that it might not account for or protect from racial bias, because AI is still built on human perspective, right? And we have not rid our society of bias. So what do you say to that about the usage of AI in, forming these materials and this messaging, and that concern about bias?
I think that's where the diversity of workforce plays a role. You need to have a diverse workforce that's helping to build these solutions. Because a lot of times, as we've seen in the last 20 years of health technology, people are building it without any of us in the room. So we have to be present and really providing that contribution where it's not that the idea of diversity or multilingual resources is not a product roadmap for 2 to 3 years.
Yeah.
The MVP, the minimal viable product that everybody talks about, should be something that's minimally viable for everybody, not just a luxury to have. But having a diverse workforce will really help solve the problem.
Okay, last question for you. NMQF is just inaugurating its 10th 40 under 40 class of minority health leaders in this country in a particularly tough time. What would you say for those in the newest class about how to either stay the course, use their platform, or, as you said, cultivate the messaging, to advance the messaging, to help people in these communities?
So I think the biggest thing is to still have hope. There's power in the work that we do. And it's just a matter of using this chaos to create opportunity. How do we bring people together? Working in the nonprofit space, we have to get creative with having very limited resources. So for me, it's not a new issue of dealing with very limited access to resources and having to serve the greater community. But I think this year's class of 40 under 40 leaders are truly amazing. They have a lot of experience and a lot of brilliant ideas. So I'm very hopeful in seeing how they can kind of push the needle forward, but just staying positive. I think staying positive and figuring out being a solution-oriented framework versus kind of just restating the problem is not enough.
Right.
We need to really work on how do we take what we're doing, scale it, and really think about unifying messages to bring everyone together.